Good morning. My name is Mat Sandifer. I'm the clinical director at New Vision Therapy. We are a mental health and substance use disorder clinic in Reedsville. We serve all of Rockingham County. We began in 2017 here to become part of the community in Rockingham. What we do here is we offer services to folks who find that they are struggling with substance use disorder, substance abuse, more commonly known. We specialize with opiate use disorder using medicated assisted treatment, which means that we have a doctor that will prescribe medication to help folks slowly wean off opiates without going through withdrawal, which is very painful and uncomfortable. And then we provide individual and group counseling to support folks learning to live life without using chemicals. Now, I think it's really important to understand what substance use disorder, substance abuse is. It is ultimately has to be self-diagnosed. What we can do is give you the latest research, and we do this, give you the latest research about what substance use disorder is. But a good telltale for folks is if you've ever asked yourself this question: do I have a problem with X? Pills, alcohol, marijuana, cocaine. If you've asked yourself that question, it's probably worth coming to a professional who can help you evaluate that and assess that. The question is usually not asked if someone isn't worried about their use of those chemicals. So what the research shows us is that when you use a substance of abuse, a street drug, a pharmaceutical, common pharmaceuticals that alter the brain chemistry that can begin addiction are opiates, benzodiazepines. Opiates are Oxycontin, oxycodone. Benzodiazepines are Valium, Klonopin, Xanax. Those drugs will alter the brain. In a certain percentage of folks, roughly in North America, about 10% of the population, that altering of the brain will lead to unpredictable usage of that drug or other drugs. That is the most common telltale sign of substance use disorder. It's not that every time you use the drug, there's a problem. It's that there are times when you can use the drug and it's okay, and there's other times when you use the drug and unpredictable things happen. Sometimes folks around you, loved ones, family, friends, co-workers, employers will begin to notice things and begin to ask you questions. If you are asked questions about your chemical use and you find that offensive, off-putting, you get defensive, again, that can be another sign to seek out help and ask for an evaluation and an assessment. So at New Vision Therapy, what we do is we provide those services. We do it in a non-judgmental way. It is difficult because of the stigma associated with substance use disorder to reach out and ask for help. Folks, unfortunately, still see alcohol use, marijuana use, cocaine use, opiate use as character flaws if you, quote unquote, can't control it. Well, the reality is it would be like telling someone with diabetes that they should be able to eat cake and control their blood sugars. It's a biological process beyond the use of willpower. So the way you manage diabetes is you change your life, your lifestyle, how you eat, what you eat, exercise. That supports the pancreas, which then can regulate your blood sugar. Sometimes you have to take insulin to help your pancreas function. Well, substance use disorder is similar. It isn't that you can learn to take the medication or learn to hold your liquor. It's that the brain, for some people, is not able to predictably manage the use of those chemicals. And so the way you treat that is with lifestyle changes. And that has to do with therapy, with changing who you're hanging out with, places you go. It has to do with developing a new spiritual way of living, and spirituality can encompass any religious belief or none. That's really up to the individual to define and to decide. And there are treatment paths that are individualized that can help folks develop lifestyles that are supportive of not using chemicals to cope. The brain is an amazing, amazing organ that we are just coming to understand. And what the brain does is it creates memories associated with behaviors. In other words, if someone discovers that taking alcohol, a drug, helps them manage with stress, with trauma, with difficult situations, that memory is then created. So the next time there's a stressful crisis event, the memory will be in the mind to use that chemical as a way to cope. Roughly 10% of the folks that have that memory are also going to have the part of their brain that is responsible for survival begin to be rewritten. So that part of your brain is known commonly as the limbic system. The limbic system is your survival aspect of your brain. It's the fight or flight or freeze. And if you think about it, if you are in a stressful situation, you might be the kind of person that says, well, I got to fix it. I got to take care of this. That's the fighter in you. You might be the type of person that says, I got to get out of this situation. That's the fleer. Or sometimes people in those crisis situations freeze and don't know what to do. That is a very basic part of your brain helping you survive. Your brain's primary job in the end is survival. What happens for some folks is that gets rewritten, and instead of the fight, flight, or freeze, a new option is added, and that's to use the chemical. So for folks that have that rewritten part of their survival response to include alcohol or use of other drugs, when you have that stressful event and the memory of how it worked before comes back, you use that chemical to cope, and it reinforces the brain's belief that this is necessary for survival. That's why it's so baffling to friends and family members of folks suffering from substance abuse. Folks will use alcohol or drugs at very inappropriate times. Doesn't make any sense. Things might be going okay. Might be a celebration, like a wedding. And in a wedding, people are excited, they're feeling good, and someone with substance use disorder might overuse and create a scene, create a disaster. Family members are baffled, they're horrified, they're hurt, they're angry. But to the individual who's using the chemical, it was necessary. It was a celebratory time. They couldn't control how much they were using because that part of their brain, which is in charge of making rational decisions, has been short-circuited by the survival limbic system. So what we do at New Vision Therapy and best practice is that we evaluate where you are in your use process. Like any chronic illness, there are stages. You don't start off immediately being at the late stage of the process. Someone doesn't develop diabetes and they're in late stage diabetes with liver failure. You develop it over time, and the process of the disease begins to wear out the body and the organs. And that begins to break down the body's ability to manage and control. And the same thing happens with substance use disorder. And so folks usually will begin with alcohol and marijuana, usually where folks start, and they will progress to other chemicals, usually getting to chemicals that alter the brain more severely: cocaine, methamphetamine, opiates. The altering of the brain then has become so severe that when folks try to stop using those chemicals, the brain wiring is such that it can't adjust quickly. And that's why supports like therapy, group therapy, individual therapy, doctor support with medications help the brain heal as you as the sufferer with substance use disorder are developing coping skills to be able to live differently. I like to think of therapy and medication as a cast to the brain, kind of holding things in place while the brain heals, just like a cast helps hold the bone in place as it mends and heals. The process of that healing can look different for different people. So it can be an office-based setting, such as what we do. An office-based means that you come in twice a week for group and individual, you see the doctor. Sometimes that level of care isn't sufficient, and so you have to have a higher level of care. And that can look like something called intensive outpatient. That can be 3 or 4 days a week. You're in group therapy, you're in individual therapy, seeing the doctor. That can be in a local hospital, a local clinic. If that level of care doesn't work, then you can look at partial hospitalization, where you spend the day at a hospital, but you come home and spend the night at home in your environment, or full hospitalization, or also known as inpatient treatment, which can be anywhere from 2 to 4 weeks to, in some cases, long-term treatment, where you live someplace for 3 to 9 months to a year, developing coping skills in a supportive environment. Where you would be best served in that spectrum of care really depends on the individual's coping skills, the amount of damage the chemicals have done, and also we need to take a look at the amount of trauma and crisis situations that each individual is coping with. You know, if you have a supportive home where folks are supportive of your recovery attempts, it's a safe environment, the stress level is relatively moderate, your level of chemical use is moderate but a problem to you and concerning to you, your level of care can be less. So what we do, and it's very important, is to look at each individual's life situation, the environment in which they're living, the stressors that they are coping with or aren't coping with, to try to match you to the best level of care appropriate. So if you or someone around you suggests that you need to reach out for help, what that can look like is calling us at New Vision or one of the providers in the county and saying, I need help. What you'll do is you will reach our admissions department, and they are going to ask you some questions that maybe you're not used to answering. They're going to ask you about insurance, whether that's Medicare, Medicaid, or commercial insurance. They're going to get some basic information, but after that, they're going to ask you some pretty frank questions about your chemical usage. And lots of times, folks have spent their time hiding that information or ashamed about that information. That is not information that we are going to use to chastise you or to judge you. That helps us know whether we're the best fit for you or help you find someplace else that's a better fit for you. So please know it's just a matter of information, no judgment at all. When you have been pre-screened, is the term that we use by admissions, and you're determined to be an appropriate fit for the services that we offer, we will schedule you an appointment within 24 to 48 hours. That appointment can be done either in person or by telehealth. In this world of the pandemic, we are offering telehealth services for folks that, for co-occurring health concerns, do not feel safe coming into our office to meet face-to-face, or if you have transportation issues or childcare issues, and it is just more convenient and more realistic to do it by telehealth, we offer those services. However, if you prefer to do it in person, not inpatient, or if you're not as familiar or comfortable with technology, you can come in person get an assessment. That assessment takes about an hour, and what we're doing is going to ask you questions about your life. Some of those are going to feel personal, but it's just like going to the doctor and the doctor asking you personal questions about your health. We're going to ask you about your life, your stressors, your chemical use. We'll ask you a little bit about your childhood, about your current living environment. That information then will be used to convey to the doctor, who you will have an appointment with within a day or two after that assessment. At that time, if it is appropriate, we will use medicated assisted treatment and recovery. What that means is some medications help the brain cope with cravings, withdrawal, stress, and anxiety. And based on your information given during the assessment, the doctor will provide those medications to you. Now, there is some concern that using medicated assisted treatment and recovery is simply a replacement for other drugs. That's kind of like equating with diabetes the use of insulin with willpower. Sometimes the pancreas just doesn't work really well. And even if you make substantial lifestyle changes, the pancreas needs additional help, and that's the job of insulin. Well, sometimes the brain is so damaged by trauma, stress, drug use, that it needs additional help to heal. If you take a drug from the street, you're prescribing to yourself and you're monitoring to yourself. There are no levels of accountability or expertise to help protect you and keep you safe. With medicated assisted treatment and recovery, we provide all of that for you. We're using FDA-approved medications to help your brain heal. The doctor monitors you weekly in the beginning. As you stabilize, that will space out to every 2 weeks, 3 weeks, 4 weeks. You are also seen individually and in group weekly to help support you, provide accountability, and to help to make sure that the medications that you are being prescribed work effectively. You know, another way I think about this is, and I'll use myself as an example, I have severe allergies and also severe asthma. I get triggered with my asthma when I exercise. So I take 3 drugs a day to be able to breathe. Now, some of those are maintenance drugs, and some of those drugs are when I'm in distress. So am I dependent on those drugs to be able to breathe? You betcha. But I like breathing. And it's not because I haven't changed my lifestyle. You know, I used to smoke cigarettes. I don't smoke anymore. I live a pretty healthy lifestyle, but that wasn't enough to help my lungs work well. And so I had to take those medications to help my lungs work. It's the same philosophy with the brain when it has been damaged by the chronic use of drugs of abuse. So our philosophy is, let's get the brain stable, let's develop effective coping skills and supportive, nurturing lifestyle, and then we begin to look at tapering medications. For some people, that's tapering down to the lowest level possible. For some folks, that's full detox. Everybody's individualized. The time frame in which that happens is different for everyone. So it's really thinking about using medications to help the brain function more effectively while supervised, while under the care of a doctor. It's really simply put the difference between drugs and medication. Folks take drugs, whether they're pharmaceuticals or off the street, to be able to accomplish the same goal of coping. But those drugs are self-administered, usually, not always, but usually obtained without supervision and without the guidance of a medical provider that can help support and monitor the use of those medications. So it moves from drugs to medications when you have those additional supports around you. Now, the research is really, really clear. If all you do is give medicated assisted, just give the drug, then that's not effective. But if you give medicated assisted treatment, group, individual therapy, and recovery, living life differently, going about your day differently, the research is clear. That is the most effective long-lasting approach to dealing with the chronic brain illness of substance abuse. So, just to break it down, if all you do is take the medication, that's barely scratching the surface. That is the same as taking a drug off the street. But when that is monitored by a medical doctor, it's supported with individual and group therapy, as well as developing lifestyle changes, that full picture, that continuum of integrated care helps the individual manage their chronic brain illness. There is no cure to this brain disorder. Chronic diseases are ongoing. They have established symptoms that can help identify that disease, but that disease is not curable. Diabetes, heart disease, asthma, substance use disorder. Acute diseases, colds, the flu, COVID-19, have a start and a stop. Sometimes that stop is death, sometimes it's not. But with a chronic illness, it is about managing and reducing the symptoms of that illness long term. With substance use disorder, there is this unfortunate belief that folks don't get better. But if you look at the research, and this is research out of the National Institutes of Drug and Alcohol Studies, the rates of compliance and relapse in symptoms among chronic diseases, including substance use disorder, are similar. So what that means is diabetes has one of the lowest rates of compliance and the highest rates of relapse in symptoms. In other words, folks don't follow their diet, they don't exercise, they don't take their medications. But if you look at asthma, it has one of the highest rates of compliance and one of the lowest rates of return into relapsing symptoms. Folks are more willing to take their medications and follow the lifestyle changes needed. The idea is that diabetes consequences are not as immediately seen. They take a while to build up, to break the body down. Whereas asthma symptoms are you can't breathe. So people are more likely to be compliant because the consequences of not following are immediate. Well, substance use disorder is actually right in the middle of that. The compliance with treatment protocols and the recurrence of symptoms are actually better for substance use disorder than diabetes. It is roughly about 60% of the folks that are engaged in some treatment process will be compliant with that treatment process. So that is better than diabetes, not as good as asthma. Is there room for improvement? Yes, absolutely. But it's important to understand that many times family and friends are really not very hopeful that their loved one can get better. The research shows that folks do get better, and they get better at rates higher than what most people expect. Here is the statistic that I really hang my hat on. When folks follow the plan developed for them, stay in contact with their treatment providers and their doctor, the rates of a return to symptoms, in other words, they start using chemicals not prescribed, are zero. That doesn't mean there aren't struggles. That doesn't mean things don't have to be adapted. That doesn't mean things don't need to be changed. But when someone is taking their medication as prescribed, talking to their provider, letting folks know what's working and not working, it becomes a collaborative team effort to continue to work on improving and managing the symptoms of substance use disorder. And that's what we do at New Vision Therapy. We monitor folks with urinalysis weekly. Those urinalysis are not gotchas. They're not I told you so's. They are simply helping us to make sure that one, medications that aren't prescribed are not being taken, and two, that the medications taken are at the correct levels. However, that is only one piece of the puzzle. The rest of it is what you as an individual tell us about how things are going. Are things improving? Are you struggling? Has something new happened in your life? Has something good happened? Do you feel like at a place where you want to try to taper? It is about a communication, a team approach between you and the folks you've hired to support you in dealing with substance use disorder. And that is the best way to treat substance use. There is not one size fits all for anybody. And that's true for all chronic diseases. Anyone that understands trying to motivate folks to stay engaged in a treatment process knows that it's got to be something that you believe in. Doctors, therapists telling you what to do will only last so long, if at all. But once you believe it's working for you and it becomes your process, then your willingness to work with the team to make this an effective process is much higher. And that's what we try to nurture and grow at New Vision Therapy. Many times with substance use disorder, folks are very discouraged, whether it's for themselves or within their family, or if you just look in your neighborhood or your community. The reality is it can feel overwhelming. And so one of the things that we firmly believe is let's start right here, right now with you. If you have a loved one you're concerned about, reach out, ask for help. There is help. If you are concerned about your substance use, do the same. What we will begin to do is work with you as an individual and within your family to help you find solutions. It can be very, very scary. There's lots of hurt feelings. There's anger. There's confusion. And so there are also community supports that I would really encourage you to reach out to. There is Celebrate Recovery at your local churches. There's also Al-Anon and Nar-Anon. Those are community-based supports for friends and family members of alcoholics and drug addicts. Sitting down with other family members who have similar experiences helps to instill hope. Just like when someone who has substance use disorder, an alcoholic or an addict, sits down with someone else struggling with the same thing, they find hope with each other. There's something that happens when human beings begin to talk to each other and begin to discover that they have similar struggles and similar solutions. So I think the biggest thing, and it's the hardest thing to do with substance use disorder, talk. Don't keep it private. Reach out for help. Go to your minister, your priest, your rabbi. Ask for help. They can reach out and help you identify community resources. Reach out to your local mental health. Reach out to your local hospital. They can also help you identify. Google, Bing, DuckDuckGo search substance abuse, mental health supports in Rockingham County. And it will give you a list of resources that you can reach out to and talk with folks. At New Vision Therapy, we offer family counseling for family members that would like it. We do know that folks with substance use disorder do better long term, have better outcomes if the family understands and supports. It is analogous to if a tree is sick and you dig that tree up and you move it to healthy soil and replant it, it's going to thrive and grow. But if you move it back to the soil that is sick, it's going to get sick again. And so what you have to do is replace the soil where the tree got sick. What that means is if the environment the individual's in is not supportive of recovery, it's going to be difficult. So sometimes family members will need to find their own supports through therapy, spiritual practices with ministers, priests, to help them begin to heal the damage done. And that's tough, particularly when, as a family member, you see, I didn't cause it, they caused it. And that's true. The substance use disorder in the other person caused all of the crisis, the hurt, the heartbreak. But the reality is the hurt and the heartbreak is still there, and it's not going to magically go away. There are ways through Al-Anon, Nar-Anon, and therapy for you to begin to heal that. Again, I would say go back and look at the statistics. Sometimes it's important to look at the numbers, the hard numbers. because when emotions are strong, it's hard to be able to have objective viewpoint. But if you look at the hard numbers about the percentage of folks that improve, it's very good for substance use disorder when that individual is communicating with their treatment provider, like any other chronic illness.